Hey there, and welcome back to Hourman TV, where we dive deep into men's health and share practical tips to help you live your best life. Today, we're talking about something that doesn't get enough attention, but plays a huge role in your overall health and performance: your pelvic floor muscles. These muscles are like a hammock that supports your bladder, bowel, and sexual function. When they're weak or overly tight, it can lead to a range of issues, from urinary incontinence to erectile dysfunction. Understanding the causes, symptoms, and how to manage them can make a world of difference. So let's get started. Discuss weak pelvic floor muscles. Weakness in this area can arise from various factors, many of which relate to our lifestyle and health. Here are some common causes. Childbirth. For women, vaginal delivery, especially with a large baby, prolonged labor, or the use of forceps, can stretch and weaken the pelvic floor muscles. Multiple pregnancies increase the risk. Aging. As we get older, muscle tone naturally decreases, including in the pelvic floor. Hormonal changes. For women, hormonal shifts during menopause can lead to decreased muscle elasticity and strength in the pelvic floor. Men also experience hormonal changes, particularly a decline in testosterone levels, which impacts muscle strength and overall vitality. Chronic straining. Activities like heavy lifting or prolonged straining during bowel movements can put excessive pressure on these muscles, leading to weakness over time. It's essential to be mindful of how we engage in heavy lifting to protect our pelvic health. 5. Obesity. Excess body weight increases pressure on the pelvic floor muscles, which over time can lead to weakening. Maintaining a healthy weight is crucial for pelvic floor support. Pelvic surgery. Surgeries in the pelvic region, such as a hysterectomy for women or surgeries related to prostate health for men, can sometimes damage these muscles, resulting in weakness. Lack of exercise. A sedentary lifestyle or neglecting targeted pelvic floor exercises, like Kegel exercises, can lead to muscle atrophy. Regular movement is vital for overall muscle health. Chronic coughing. Conditions like asthma, bronchitis, or smoking-related coughing can repeatedly strain the pelvic floor, leading to weakness. If you're dealing with a chronic cough, it's essential to seek medical advice. High-impact activities. While exercise is generally beneficial, high-impact activities like running or jumping can sometimes overstretch or weaken the pelvic floor if not balanced with strengthening exercises. Genetics. Some individuals may have a genetic predisposition to weaker connective tissue or pelvic floor muscles, making them more susceptible to weakness. Pelvic trauma or injury. Injuries to the pelvic region, such as from an accident or surgery, can damage the pelvic floor muscles. Neurological conditions. Conditions like multiple sclerosis, spinal cord injuries, or nerve damage can affect the nerves that control the pelvic floor muscles, leading to weakness. These conditions require careful management and treatment. So how can you tell if you have weak pelvic floor muscles? Here are some common symptoms to look out for. Urinary incontinence. This includes leaking urine during activities like coughing, sneezing, or laughing, often referred to as stress incontinence. Many individuals may feel embarrassed about this, but it's more common than you might think. Frequent urination. An urgent need to urinate often, sometimes with little warning, can disrupt daily life and lead to anxiety about being away from a restroom. Fecal incontinence. Difficulty controlling bowel movements can be particularly distressing and can significantly impact quality of life. Erectile dysfunction. You may notice reduced rigidity during erections, which can affect self-esteem and relationship dynamics. Pelvic organ prolapse. This is a sensation of heaviness or pressure in the pelvic area, which is less common in men but still worth noting. Post-ejaculation pain. Discomfort after ejaculation can arise due to poor muscle control, causing additional concern. If you recognize any of these symptoms, it's important to take action. You're not alone, and help is available. On the flip side, overly tight pelvic floor muscle can be just as problematic. Tightness here can cause pain, tension, and even erectile dysfunction. Tight pelvic floor muscles can result from various factors, often involving physical, emotional, or behavioral triggers. Here are some common reasons. Chronic stress or anxiety. Emotional stress can lead to muscle tension throughout the body, including the pelvic floor. When you're stressed, your body goes into a fight or flight mode, causing muscles to tense up. This can happen without you even realizing it, leading to tightness in the pelvic area. Overuse or overactivity. Engaging in repetitive activities that strain the pelvic floor, such as heavy lifting, high-impact exercises, or even excessive Kegel exercises, can cause these muscles to become tight and overactive. While Kegels are beneficial, too much of a good thing can lead to problems. Poor posture. Prolonged sitting, especially with poor posture, can put pressure on the pelvic floor muscles and lead to tightness. Slouching or tilting your pelvis forward can exacerbate this issue, creating a cycle of discomfort. Trauma or injury. Physical trauma, such as pelvic surgery or sports injuries, can cause the pelvic floor muscles to tighten as a protective response. The body often reacts to trauma by tightening muscles in the affected area, which can lead to chronic tightness. Pelvic pain syndromes. Condition like prostatitis can lead to tight and painful pelvic floor muscles, significantly affecting quality of life. These conditions can create a cycle of pain and muscle tightening, making it essential to address both the pain and the muscle tension. Habitual muscle guarding. Some individuals may unconsciously clench their pelvic floor muscles due to pain, fear, or habitual stress, leading to chronic tightness. This can become a learned behavior, making it difficult to relax the muscles even when the stressor is removed. Nerve dysfunction. Nerve irritation or damage in the pelvic region can cause the muscles to contract excessively, leading to tightness. Conditions affecting nerve function can further complicate the situation, making it essential to seek appropriate medical advice. Lifestyle factors. Sedentary behavior, lack of stretching, or wearing tight clothing can restrict movement and contribute to pelvic floor tension. Simple lifestyle changes can often alleviate some of this tension. Pelvic floor dysfunction. This condition occurs when the pelvic floor muscles do not relax properly, leading to tightness, pain, and other symptoms like urinary or bowel issues. An overly tight pelvic floor can lead to pain, tension, and dysfunction due to excessive muscle contraction. Here are some common symptoms to be aware of. Pelvic pain. Chronic pain in the pelvis, lower back, or perineum can significantly affect daily life and activities, making it difficult to find comfortable positions. Painful urination. Discomfort or burning during urination, even without a urinary tract infection, can be a sign of tight pelvic muscles. This symptom can lead to increased anxiety about urination. Difficulty urinating. If you find yourself straining to start or fully empty the bladder, this can suggest muscular tension in the pelvic area. This symptom can disrupt your daily routine and make you avoid social situations with limited restroom access. Painful ejaculation. Some men report discomfort during or after ejaculation due to tight pelvic floor muscles, which can impact sexual satisfaction and lead to anxiety around intimacy. Erectile dysfunction. Muscle tension can lead to difficulty achieving or maintaining an erection, affecting self-esteem and relationships. Understanding the link between muscle tension and erectile function can help you address these issues effectively. Constipation. For some, tight muscles can contribute to difficulty passing stools, causing discomfort and digestive issues. This can create a cycle of stress and anxiety around bowel movements. Pain with sitting. If you experience discomfort when sitting for long periods, this could be another sign of tight pelvic floor muscles. Many people spend a significant amount of time sitting, whether at work or home, and discomfort can hinder productivity and enjoyment of daily activities. Now that we've covered the symptoms, let's discuss how to differentiate between weak and tight pelvic floor muscles. This is crucial for effective treatment. You may notice difficulty stopping the flow of urine midstream, a common test for pelvic floor strength. Many men may not realize that this is a simple yet effective way to gauge muscle strength. Conversely, if you find it hard to relax the pelvic floor, leading to pain or difficulty with urination or bowel movements. This may point to tightness. Typically, weak muscles lead to leakage or a lack of control, which can be distressing. On the other hand, tight muscles often result in pain, tension, or difficulty relaxing, making it essential to identify the root cause. Consulting a healthcare provider, such as a urologist or pelvic floor physical therapist, can provide clarity. They can perform a physical exam to assess muscle tone, strength, and flexibility, and evaluate for underlying conditions like prostatitis, nerve damage, or pelvic trauma. If you suspect either weak or tight pelvic floor muscles, here are some steps you can take for prevention and treatment. First, let's focus on weak pelvic floor muscles. Pelvic floor exercises, Kegels. Regularly performing Kegel exercises can help strengthen these muscles. We have a video on Kegel exercise. The link is in the description. Remember, consistency is key for these exercises to yield results. Healthy lifestyle. Maintaining a healthy weight, avoiding heavy lifting, and managing chronic coughing can significantly improve pelvic health. Incorporate more fruits and vegetables into your diet and include exercise in your daily routine. Physical therapy. If you're unsure about how to strengthen your pelvic floor properly, consulting a pelvic floor physical therapist can be incredibly beneficial. They can provide personalized exercises tailored to your specific needs and guide you through techniques that ensure you're effectively targeting the right muscles. Biofeedback. This technique can help you gain awareness of your pelvic floor muscles. Using monitoring devices, biofeedback allows you to see in real time how well you're contracting and relaxing these muscles, making it easier to learn proper techniques. Surgical options. In severe cases of pelvic floor dysfunction, such as prolapse or incontinence, surgery may be considered. This is typically a last resort after exploring other options. If surgery is necessary, a urologist can guide you through the process and discuss what to expect. If you suspect that you have weak pelvic floor muscles, it's essential to reach out to a healthcare provider, such as a pelvic floor physical therapist or urologist. Now let's focus on tight pelvic floor muscles. Here are some effective strategies for treatment and management. Pelvic floor physical therapy. A specialized therapist can teach you relaxation techniques and stretches that are specifically designed for the pelvic floor, like the butterfly abduction stretch, the happy baby pose, lying pelvic floor stretch, and some stretches you can do by sitting on a bottle or tennis ball. This can help alleviate tension and promote muscle relaxation. Breathing exercises. Diaphragmatic breathing, also known as deep belly breathing, is a fantastic way to help relax the pelvic floor. As you inhale deeply, visualize sending breath to your pelvic area, allowing it to soften and release any tension. Practicing this technique for a few minutes each day can create a significant impact on how your body feels. Stress management. Stress can exacerbate muscle tightness, so it's important to incorporate stress management techniques into your routine. Activities like yoga, meditation, and even simple mindfulness practices can help reduce overall tension. Finding time for relaxation each day can make a world of difference. Stretching and strengthening. Gentle stretches and exercises can improve muscle balance and alleviate tightness. Consider incorporating yoga or Pilates into your weekly routine, focusing on poses that open up the hips and lower back, as tightness in these areas can contribute to pelvic floor tension. Biofeedback. Just as with weak muscles, biofeedback can be an effective method to learn how to control and relax your pelvic floor. This can help you become more aware of your muscle tension and how to manage it effectively. Medical interventions. In some cases, medications or injections may be necessary to alleviate tightness and discomfort. Always consult with a healthcare provider to discuss these options and determine the best course of action for you. Consulting a healthcare provider. If you suspect you have tight pelvic floor muscles, consulting a healthcare provider, such as a pelvic floor physical therapist or urologist, is highly recommended for proper diagnosis and treatment. They will be able to assess your condition and provide you with a personalized treatment plan. In this video, we've learned the importance of balance in whatever activity we engage in that affects our body. Do not allow your muscles to go to sleep, and while you are exercising, your goal should be to keep them active, not to test limits. Similar to that, we've established that Kegel exercises are not always the answer for every pelvic floor muscle challenge. While Kegels are beneficial for strengthening weak muscles, they may not be suitable for those experiencing tightness. Tight pelvic floor muscles require a different approach. It's also essential to recognize that Kegel exercises are not a cure for all causes of erectile dysfunction. Psychological factors, vascular issues, hormonal imbalances, and other medical conditions can also play significant roles, even when your pelvic floor muscles are functioning well. That said, Kegel exercises of different forms can still be highly recommended for everyone as a preventive measure. We'll discuss this in more detail in our next video, so be sure to subscribe and stay tuned. Thank you for joining us today. Remember, understanding your body is the first step toward better health. If you have any questions or topics you'd like us to cover, please leave a comment below. Until next time, take care and prioritize your health.